Hello and welcome to AMCN channel of ITRA. I myself, Dr. Neha Tag, working as an associate professor in the Department of Panchakarma, would like to describe in detail about the Shirodhara, which is a widely renowned procedure of Panchakarma not only at the national level but also at the international level. Shirodhara is a process where we are doing a procedure on the forehead. This is described in Ayurveda under the topic of Murda Taila. Murda Tail means the various medicines which are applied on the head where the main drug is oil. Under that, one of the procedure is a Shirodhara. Shirodhara is mentioned in so many Sahitas and has a very widely acceptance not only at the national but at the international level, because head is considered to be the Uttam Anga, that is the best organ in our body, and it is compared to as an uprooted tree. The whole body where the roots are in the head region and the whole body, that is our trunks, are considered as the branches. Now nourishing the roots will automatically give the nourishment to the tree. Same way, nourishing the head through Shirodhara, we get overall whole body various types of benefits. This pouring of the liquid on the forehead known as the Shirodhara, we are using various types of oil, buttermilk, decoction, so many medicines are practiced in the present era. Shirodhara, the word Shiro means the head and Dhara means the continuous flow. In this practice, the warm liquid is gently poured steadily on the forehead. But one thing I would like to make clear, that this is not a procedure of a massage, this is not a force, and this is not as a rhythm also. Ayurveda believes that forehead is a very sensitive area which is connected to our whole body. The rhythm introduced here will naturally calm down our mind. This calming effect of the mind is such a widely popular that Ayurveda has recognized its international platform with this, of course, a very small procedure known as the Shirodhara, to such an extent that presently Ayurveda has a synonym Shirodhara and Shirodhara has a synonym of Ayurveda, because it is the major treatment for our relaxation and rejuvenation. At international platform, people are practicing widely Shirodhara because of its efficacy. Shirodhara, we have to understand this nicely and to avoid our misunderstanding that it is not a massage technique. Many people are also interpreting it as a music therapy, and it is not an hypnosis, it is not a religious and it is not a ritualistic practice. So rather, Shirodhara is a precision based neurosensory intervention, but it is a consistency, repetition and correct parameters determine its effectiveness. So now coming to its detailed description, we can divide the whole procedure in 3 stages, that is the Purva Karma explaining about the pre-procedure, Pradhan Karma, that is the main procedure, and Paschat Karma, that is the post procedure. So we start with the Purva Karma and each step has its own rationale for performing it. So here we begin with the most important before Shirodhara, that is the food advice, that whenever we are taking any food, it has to be digested properly before performing Shirodhara, or it is more advisable that we advise the patient to come in the morning hours with a light breakfast just before 2 hours or 1.5 hours before performing the Shirodhara. At the same time, we are also advising the patient to be free from the various natural urges of urine and defecation, because if patients are suppressing these natural urges, there is a vitiation of a Vata during the procedure which may worsen our condition. And after all these procedure, pre-procedure, that is the evacuation of the urges, light food, completely calming and taking all the vital medicines like hypertension, diabetes, anything if patient is taking, then they have to take it, they have to calm down and then they can come for our Shirodhara procedure. At some places we are also seeing that people are doing some form of head massage as a pre-procedure for the Shirodhara. This pre-procedure of Shiro Abhyang is not an optional thing, it is not a compulsion, but if we are performing, it will prepare our scalp and reduces the dryness, calms the surface nerves, and it is not a compulsion, but it will help as a pre-procedure also. For a protective measures, we have to insert the cotton ears in our ear plug, a band on the forehead to control the oil flow, cotton pad on the eyes reduce the visual stimulation. When senses rest, mind naturally turns inward. So, in a way actually we are diverting all our senses and we are concentrating them towards the focus and for the more meditation. We have practices such as Zen meditation, Zaitai, Kampo-based constitutional therapy and forest-based relaxation approaches. This emphasizes reduction of sensory overload, rhythmic continuity and internal regulation rather than forceful intervention. Shirodhara differs in technique, but ultimately it is also providing all this relaxation. The only difference is about the languages. Now we come to the position of the Shirodhara. This is again very important because we are asking the patient to lie down for minimum 30 minutes and maximum it can go for 45 minutes, 1 hour or 1.5 hours also. So, proper position guidance is very important. Patient is asked to lie in a supine position and Dhara Patra has to be brought 4 inches above this head. The eyes and ears should be covered as we described previously, so that any type of drug or any type of liquid may not go inside it, and at the same time they are more concentrated and focused on their inner mind. The head of the patient rests on a slightly elevated wooden piece there on the table. So, this is we have to see the droni is there. Droni is actually a special type of a table which is used for the Shirodhara, and the table is made up of wood and it has raised edges. These days we are also getting the table which is made up of fiber, and in all 4 sides the edges are there so that the oil does not flow out. In this table management are made on the head so that the oil poured may be collected in another vessel and may be reused. The construction of droni is explained and converted into the present measurement from the Samhita. So, the approximate measurement will be the length of the 7 feet, the breadth is 2.5 feet and the height is about 2.5 feet. On all the side of the table, 3 inches elevated boundary is constructed, and also towards the side of the head, 2.5 feet one horizontal middle strip of wood may be constructed, by which the table is divided into 2 parts. Now we come to the Dhara Patra. Dhara Patra is the vessel in which we are going to fill our liquid, whatever we are going to use for the Shirodhara. So, it can be made up of brass, steel, clay, and in our Samhita it is said that it is, if we can use also silver and gold also. The mouth of the vessel should be wide and sides are tapering gradually to a ventral point in the bottom. At this point a hole is may be there, so that approximately of the little finger size, so the liquid which we are filling in the Dhara Patra can flow easily on the forehead. The depth of the vessel may be 5 to 6 inches, so that the capacity of the liquid can be 2 to 3 liters, which a Dhara Patra can hold it. Inside the vessel, a small wooden bowl having a central hole should be put inversely, so as the both holes of the vessel come in the medial line. In this small vessel, a wick of about 4 inch in size should be entered, passing through both the holes and hanging down from the big vessel. The upper end of the wick should have knot to prevent slipping from the vessel. The Dhara Patra should be hanged just above the forehead of the patient. the vessel is kept refilled with the recollected liquid. On the upper edge of the vessel, 3 holes should be made to hang it in a horizontal plane to avoid the spillage. These days, various modifications have come in this Dhara Patra and Droni. We also have a semi-automatic, fully automatic Shirodhara table, where we do not require the help of any measure. The liquid gets automatic collected, temperature is maintained, and the oscillation which is required for the Shirodhara procedure is also continued. So, this type of various Shirodhara instruments are also available in the market. Now, the most important thing is about the selection of the drug for the Shirodhara. Whatever drug we are selecting, the most important factors to be kept in mind are about the constitution of the patient, that is its Prakruti. As per Ayurveda, there are different types of Prakruti having the dominancy of Vata, Pitta and Kapha dosha, and also the mixed Prakruti. According to this Prakruti, and at the same time whichever visheshan of the dosh is there in the body, accordingly we have to select various types of the drugs. Still there are few suggestions, like if it is a Vatic rog, we can select various types of decoctions which decreases the Vata, like the Shmulkwatha, Erandmulkwatha, and various forms of oil preparations like Balatel, which are very useful for the decrease of the Vata which is aggravated. At the same time, for the Pitta Roga, we can use Chandana, Ushira, Kwatha, medicated milk, which can be medicated with various types of mind calming drugs. For the Kapha Rog, we can use Nagar, Musta, Madhuyashti Adi Kwat, and various types of other oil also. According to Dhara Kalpa, Sneh is selected as per the condition and as per the visheshan of the dosha. So, there are few suggestions in the book Dhara Kalpa, that if it is Vata dosha, we can select Til Tela. If it is Pitta dosha, we can select only Grita. If it is Kapha dosha dominancy, we can select Til Tela. Rakta dosha, again Grita. Vata, Pitta and Rakta, Grit and Tel in equal proportion, and where there is visheshan of Vata, Kapha and Rakta, half part we can take Grita and one part Til Tela. But in the present era, we have seen that at most of the places people are using oil only rather than ghee because of the easy availability. This is one of the option. Now, about the various liquids we are using, like it is done with the water also, it is done with the buttermilk, it is done with the medicated milk, it is done with the quath, various types of drugs are used. Actually, these are various types of modifications, because whenever we see the reference of this Shirodhara, it is mentioned nicely in Murda Tela. So, it is actually under the Murda Tela various medicated procedures on the head region using the oil. Now, this conversion of the liquid to various decoction, buttermilk and milk is the modification and as per the demand of the present era. But comparatively, we always get the best result when we are using what is indicated in our Samhita, that is oil. Now, preparation of this therapeutic medium, like whatever you are selecting, whether we are selecting medicated oil or buttermilk or milk, this has to be properly processed. Like if we are using buttermilk, it has to be processed with the amalki, jatamansi, musta, whatever is the requirement. Same way, if we are using milk, again it has to be processed with ashwagandha, we can process with the mansyadi kwatha, which are helping to calm down the mind, and whatever liquid we are collecting, that has to be placed carefully in the Shirodhara vessel. Method of the application, the liquid is allowed to flow steadily on the forehead and it should oscillate from one temporal region to other temporal region with a gentle push. This should be a proper oscillation movement rather than just flowing on the center part of the forehead, because at many places we have seen that Shirodhara there is no oscillation movement, it is just a flowing on the center of the forehead, but actually a gentle and mild oscillation is a very important for the rhythmic movement from one temporal to other temporal region, and it should be practiced like that. The various technical parameters about the height of the Shirodhara, in classics they have very clearly said that it should be about 4 angula, which approximately has a 4-inch height, and the thickness of the stream is also mentioned, that is, it is about the little finger thickness. The control temperature is also essential for optimum sensory stimulation, which should be neither too hot nor should be too cold. So, a specific height is there, the thickness of the stream is there, and temperature control is also very important. The other thing is about the environment. Silence and the soothing environment is important. Enough lighting should be there. Comfortable ambient temperature within the room is also essential for the deep relaxation. At many places, people are also having this type of queries whether they can use a AC in the Shirodhara room or not. The AC actually in any of the Panchakarma procedure is not advisable, but if the outside temperature is as such which is more warm or extreme cold, in such extreme condition we can maintain the inner temperature of our therapy room with a moderate temperature of our air conditioner. Though continuous gentle sensory input, the nervous system gradually shifts towards the relaxation, calming body and mind both in this Shirodhara if we are following all this properly. The most important thing is about the duration of Dhara. Whenever we are doing Dhara, we are always in the hasty to complete it. But always be careful, this is a very soothing and the calm procedure. We should never be in haste and should be completely with the total duration of minimum 30 minutes. So, 30 minutes is the minimum criteria, or we can also extend to about 45 minutes or 1 hour. At many places they are also practicing for about 1.5 hours, which is quite extreme, but minimum 30 minutes is the essential requirement. And also if we are not able to judge that 30 minutes is proper or not, we can also see that perspiration is there, then we can stop the Dhara procedure. Then come to total duration of the treatment. See, when minimum we have to do for the 7 days. We cannot do just like an experience of 1 day or 2 days, just come and enjoy and go, then you will not get the required amount of the result what you are expecting. So, always 7 days is the minimum requirement with the continuous repetition of 7 days, because we have also seen that many times these 7 days are completed like a weekend, 2 days, alternate days. So, that will also not give proper result. So, this minimum 7 days, if it is possible, we have to do it 7 days continuously. Moderate you can do for 10 days, 12 days and even 14 or 21 days. In many of the complicated conditions in our hospitals, we are doing for 21 days continuously, because as per the requirement of the patient, that is more essential. Even after the gap of few days, we are also doing it repetition for again 14 days or 21 days. So, this how much to extend for further duration, that depends on the vitiation of the dosha, condition of the patient and the response we are getting. But yes, minimum criteria we can say that we have to do it for the 7 days. And the same way about the preferable time. This preferable time is usually, if it is possible, between 7 to 10 am we can do it. We can also extend till 11 am. This is the preferable time in the morning hour where you get the maximum result, because as the days passes and the time increases, we have a different biological rhythm in our body. So, compared to all that, what we have seen in our hospital, that if we do it in the early morning from 7 to 10 or 11, it gives us good result. If it is a summer season, if we are doing after 11 or between 12 to 5, it is causing little bit uncomfortable sensation because of the heat. At the same time, if it is winter season, then we cannot do very early because it is very cold. Patient has to come and go also for the treatment, even though we are creating some proper temperature inside the therapeutic room, but patient has to come to the room and they have to go back again to their home. So, that time also environmental exposure is playing a very important role. Then we come to the period of changing of the liquid. We are using various types of liquid, as I already told about the buttermilk, milk, quath and oil. So, this liquid, how and when to change, this is an important guidance, because accordingly we may also induce sometimes the complication if we do not pay attention. Like suppose we are using medicated or plain buttermilk, we are using milk, and then of course it is understood that we have to change it daily, because we cannot use the same milk or buttermilk, keep it in the fridge and use it on the next day, never do like that. Daily we have to take a fresh buttermilk or fresh milk, make it medicated, and then we have to use it. Same way, if we are using decoction, again daily we have to prepare the decoction and we have to use it, and then we can discard it. And most important is about the oil. Oil we are using, that is very clearly guided in our Samhita, that whenever we are using oil, we have to use it same oil for the 3 days, and then again on the 4th, 5th and 6th day we have to use the new oil, and on the 7th day we can mix both the oil and we can use it. So, this is how it is guided, but practically what we are seeing, that if we are taking new oil for first 3 days and another oil for the second 3 days, then financial wise patient and also for the physician, these things are becoming costly. So, we have to be very careful while using the oil. We can use the same oil while reheating it and then straining it if we feel that it has become dirty. So, this thing is very important to understand about the period of changing of the liquids. At the same time, again the temperature of the oil or whatever drugs we are using, even if you are using buttermilk or you are using milk, you have to make it warm. This is important, because if you are not making it warm, then this may cause various type of complication. Never ever use any of the drug cold for the Shirodhara. If you are using water, make it warm. If you are using buttermilk, milk, decoction and oil, everything has to be warm. Now, this how much temperature we have to keep, actually every body temperature has little variation. Like suppose we have the patient which are Pitta dominancy, or the patient which are having migraine headache or anxiety, anger, then such type of patient, they have more sensitivity for the hotness. So, for them just slightly warm is enough, but for the patients like Vata dominancy, Kapha dominancy, they have a good tolerance, and for them we can make little bit more than the warm temperature. So, actually whenever we are heating this liquid, we have to check by ourselves. At the same time, we have to also put it in the Dhara patra, let it allow to flow, put our hand below the flow and check the temperature, because if we are checking the temperature just by putting a little finger in that, it is just a temporary checking. Actually when the flow is there, it is a continuous flow with the constant temperature. That time what patient is feeling is completely different. So, this maintenance of temperature, it may vary to some extent from patient to patient, but it is like 98 to 99 Fahrenheit, we can manage it. So, warm or slightly more than the warm. So, these are the various things which we have to keep it in mind while doing the Shirodhara, that is the main procedure of Pradhan Karma. And then we come for the Panchakarma, like after completing Shirodhara for about say 30 or 45 minutes, the procedure is completed. So, now what we are going to do, that is known as the post procedure care of the Shirodhara. The most important care is about the rest, because now patient has completed, immediately just in hasty, don't ask the patient to get up from the bed and tell them that now it is completed, you can go. Never do like that. Ask the patient to take a rest, slowly strain whatever liquid is there in the head region, you have to squeeze it. If patient is having a long hair, it will take time to squeeze all the oil which is there in the head, or the decoction or the milk, whatever liquid we are using in Shirodhara. So, we have to gently squeeze it from the hair. Remove all the cotton plugs which we have put in the ear. We had covered the eyes and we had also tied a cloth on the forehead. All this we have to gently remove it. After squeezing all the liquid from the head region, we can take a cotton or cloth, or we can take a towel which is of cotton and tie the hair of the patient if they are female, or with the male also you can tie the hair and the head with the small cotton cloth. So, while doing this, the dribbling of the whatever liquid is there in the head region will be prevented. What we have to avoid is the immediately don't ask the patient to travel, ask them to rest for some time. We can give the decoction which are Vata Anuloman, which causes the Vayu to go in the downward direction like Gandharva Hastadi Kvata, or we can also give Erand Mul Kvata, because it is said in Panchakarma that even if you are doing any of the small procedures, there is the vitiation or aggravation of the Vata. This aggravation can be corrected by giving the any Vata Anuloman Kvata after the Shirodhara or any Panchakarma procedure. So, when we give this type of decoction, immediately there is a release of the flatus, which gives us the sign that there is the Vata Anuloman. We can also give a Rasna Churna rubbing on the forehead, asking the patient to smell and rubbing on the vertex, on the foot soles and on the palm, because Rasna is considered to be the best Vata Shamak. So, whatever there is the disturbance of the Vayu in any of the Panchakarma procedure or in the Shirodhara, that could be corrected because of the Rasna rubbing. Immediately exposure to cold, dust, smoke and heat environment should be avoided. Physical or mental exertion also has to be avoided. Residual oil, we can ask the patient to collect it in the vessel and then they can get it back in the next day, or we can keep in our hospital also. We can also give to intake for the medicated ghee or the plain ghee. Again, this is also important to subside the Vata which is aggravated because of this Shirodhara or any of the Panchakarma procedure. Now, the most important question we face, that is about the head bath. Whenever we are doing Shirodhara with the oil, so oil is advisable to allow it to stay in the head, and we should not ask the patient to wash their hair daily. If it is like environment is as such, then we can ask the patient to wash their hair with every 2 to 3 days of the Shirodhara, and this washing of the hair also should be between the timing 12 to 3 o'clock. Because if we ask the patient to wash the hair in the late evening or in the early morning, then because of the cold in the environment, coldness in the environment, there are chances of the complication like rhinitis and fever, and if the such complication is occurring, then we have to stop the treatment. And the other side is also there, that if we allow the oil to remain in the head region, then there is a good absorption of the oil in the head, which is also very important for our post effect of the Shirodhara. But if patient are using, we are using milk or we are using decoction, buttermilk, then it is advisable then patient has to wash the hair, because we cannot ask them to keep the buttermilk or the milk in the head and not to wash the hair. So, in such condition, we have to ask the patient that they can wash the hair, but the only thing is that they should not be exposed to the cold water while washing the hair, or cold breezes, or very direct exposure to fan or the AC. And some dietary recommendations are also given. Patient has to take a light, warm and easily digestible food, so that there is no vitiation of the Vata. If a patient agree, we can give them warm water medicated with the dhania, jeerak, ginger, cumin seed, or with the shunthi. And the food and the water which are Vata decreasing, such type of foods and water are preferred. This will help to maintain the warmth within the body. At the same time, Vata, which is the main cause for all the type of vitiation of the body, will also be subsided. Various types of lifestyle guidelines are also instructed, like not to exert too much mentally and physically, and patient has to remain from the physical stress. There are various physical stress also which we are not aware, doing too much of physical exertion, going to gym, going to yoga and all that also we should be ask the patient to prevent it during this, because actually we need a total calm and the relaxed mind which may help patient to improve its function of the mind and the brain. At the same time, many patients are also not observing about the do's and don'ts. They remain awake at night, they sleep at the daytime, they eat cold drink, ice cream, buttermilk, which are again cold in potency. At the same time, they are Vata vitiation, and this will again disturb the result of our treatment. And wherever they are using the water, we have to advise them washing the mouth for bathing purpose, washing hands, everywhere they have to use a warm water. At the same time, for the mental discipline also, it is very important that patient should avoid all the type of anger, grief, emotional disturbances in the daily routine, so that we can get a very good meditation effect of the Shirodhara. At the same time, patient also has to abstain from the sexual activity and its thoughts, because this may again disturb the Vata, which is our major factor for the vitiation. The post procedure measures are mainly there because whatever functions are there of our mind, which is also related to the functions of the nervous system, can be more function better, and we get the best result of the Shirodhara, maintaining our mental calmness, sensory balance and Vata equilibrium. Now, even though we advise so much, it is also, because it is a human nature, it is also possible that there are Dhara dosha which are coming as a complication or the adverse effects of the Shirodhara. So, maybe the causative factors, like if we are performing the Shirodhara at an inappropriate height, or if the flow is too fast or too slow. That is, inappropriate height means either it is a very low or it is at very high. And whenever we are keeping the flow, the suggested is about the thickness of the little finger, but we are not doing that, then it can be too fast or too slow. Then we may have the undesirable effects such as the burning sensation, lightheadedness or the fainting, headache, vomiting or the nausea. Sometimes we may have the nasal bleeding or feverish, rhinitis and the coughing. So, it is very important that the temperature, the height, the flow, all this which are indicated should be maintained properly. If this type of complications known as the Dhara dosh occurring, then what are the possible management? The first possible management is about the advice is gandush, that is medicated gargling to soothe the oral and the head region. The second is about the nasya, that is the medicated of instillation of medicated ghee or the oil in our nostril. And the last one is about the Kashai pan. Kashai pan is the intake of the decoction medicated. It could be medicated decoction or it could be dry ginger or the shunti powder. So, depending upon what type of complication we are having, various types of the gargling, inhalation of the fumes, instillation of the medicated drops of oil or ghee in the nostrils, all these are the suggested treatment for the management of this complication. If it is occurring on the very same day, we have to ask the patient to take a light meal on that day. They can take a light soup or adding black pepper in it, and anything which does not increase the Vata they can take. If much complications are there, we can also give them about our treatment of basti, that is the medicated enema, because all the complications are ultimately occurring because of the vitiation of the Vata. And for the Vata, basti is our main line of treatment. So, on third day we can also do the medicated enema, that is the basti, where we can use the other Vata decreasing decoctions, but we have to also add the sendhav, which is very important for the correction of the vayu. So, these are the various complications what we have discussed about the Shirodhara, and the most important thing which we have to understand is about its indication, because we are facing this problem. We get information from some person, we see on the Google, and we think that we have this XYZ problem, and we reach to Ayurveda hospital deciding by ourselves that we want to do Shirodhara. We also see that the people come that we want to do Shirodhara with buttermilk. So everything is decided by themselves, and because of the impact of course the social media. But actually there are specific conditions where it is indicated that in these conditions only Shirodhara will give good result, and among them there are few like migraine. In migraine headaches we are getting very good results, even the relapses of the headache is corrected. So one of the condition is the migraine. We have various types of headache. Among the one of the headache is known as Surya Varta. It is a type of the headache where as the sun rises the headache aggravates. In that type of typical headache also we are getting good result. Facial palsy, hemiplegia, locked jaw, pain in eyes and insomnia, various pain in head region and head tremors. Insomnia is most widely practiced for the Shirodhara because people are having lot of issue with the sleep, and most of them are not ready to take the medicines for the sleep diseases, and actually they also become habituated. After taking medicine it becomes difficult that they get the sleep only after taking medicine. So we have many patients who are approaching for insomnia, and we get really very good results from the Shirodhara. At the same time we are also doing on the various diseases of the stress and various psychosomatic disorders like IBS, irritating bowel syndrome. It is actually patient is having the urge to pass the stool immediately after taking food, and it is directly related with your thoughts and the mind. So there it will work Shirodhara. And asthma, various neurological disorders like headache, epilepsy, psychiatric disorders like psychosis, neurosis and insomnia, various eczema, especially the allergic and the non-responding, hypertension and psoriasis, because psoriasis is also one of the condition which is related to the brain. We also practice in the various diseases of the Parkinson related condition, various disease of the skin, where brain is disturbed and mind is also not calm. Shirodhara should be performed with appropriate clinical judgment. So we have these various types of conditions, but at the same time, though patient may be fit for the Shirodhara, but there are few conditions that because we cannot perform the Shirodhara if patient is having active infection, if patient is having fever, they have cold and cough, congestion in the chest, then we should not perform, because these conditions will worsen or it will increase if we are doing the Shirodhara. So though patient may be fit for the Shirodhara, but we should not do it. So let patient be alright, and then we can do it for the specific condition. At the same time, if patient has taken the food and immediately after food we should not do, there are chances of the vomiting. At the same time, patient when they are having major psychiatric conditions, there are conditions like bipolar disorder or some conditions where patients are almost insane. So in such type of condition, patient don't obey us and they are not able to lie down calmly also for on the table for 45 minutes or 30 minutes. So it becomes very difficult for them to complete the treatment. So in such patients also we are not able to perform. Of course it improves the brain circulation, but because of this type of things we are not able to perform Shirodhara in some of the psychiatric major complications. But the most important thing what we have to see is this physical strength, that patient is able to lie down for such long duration, they are able to tolerate the pouring of the liquid on the forehead, at the same time mentally they are open for the treatment. So this is very important. Now there are few general observations which we come across in the Shirodhara which are very important for the practical consideration. That is, the first one is about the therapeutic environment, because with Shirodhara we are seeing the effect what we get is more about the meditation. So it is mostly insisted the surrounding should be calm, quiet and pleasant. There should not be any disturbance, because when we are doing calmly Shirodhara on the forehead, we have seen that we get the feedback that we are now going in the meditation. This type of feedback we get from the patient. So if we are making noise or there is an unpleasant atmosphere, this effect of meditation is not gained to the optimum level. Some people are also insisting of putting some aroma oils in the Shirodhara liquid, but again that is an aroma treatment, so we should not insist on it. At the same time, some music is also sometimes we are seeing there in the room, but again music therapy has its own effect. So this is more about the concentration based therapy and not the music therapy. So, and the present era, what we are seeing, the problem is about the mobile. So again, patient should not use the mobile during the Shirodhara. At the same time, the assistant who are supporting for Shirodhara or any person who are present in the room of the Shirodhara, they should not use the mobile, and at the same time they should not keep on talking with the patient, because we need a calm and the silent atmosphere. There should be a comfortable temperature in the room, not too hot, not too cold, because in summer season if it will be hot, we are not able to perform the Tel Dhara because it causes uncomfortable or heat in the head region, and in the winter season similarly we are not able to perform much about the Jal Dhara or with the Takra Dhara, that is with the buttermilk. So these few things we have to keep it in mind about the temperature and about the ambience of the room where we are going to perform it. Same way, whatever stream is there about the Shirodhara, if it is very thin, then it may cause the pricking sensation on the forehead, which may induce the headache. And if it is very thick, then the liquid which is coming from the Dhara Patra, it will flow very fast and we have to collect it again and again. At the same time, the desired effect of relaxation, we may not get it. So always we have to be careful about the thickness. At the same time, if we get any of the complication like itching or any type of burning sensation in the forehead, any eruptions, then we have to be careful and we should discontinue, correct it, and then we can start again the Shirodhara. So all these comfortable things should be maintained in the room where we are going to perform the Shirodhara. Once the patient is going back to the home, it is always advised to the patient that they have to cover their head, eyes and ears whenever they are coming for the Shirodhara and whenever they are going back to the Shirodhara, because directly exposure to the atmospheric dust and the temperature will again cause the headache, rhinitis, cold and coughing. Again, a specific advice we are giving to the patient, that is to avoid the buttermilk, curd and about the cold drink and ice cream, because immediately there is the aggravation of Vata and there is the headache and cold and the coughing. The most important thing is about the counseling of the patient. What we have to advise them, that don't expect any miraculous effect about the Shirodhara, because we have seen that patients are expecting that they are having insomnia since years or since month, and when they come for the Shirodhara, they are expecting that within a day we can give them the best result or they can get a good sleep, or any type of Parkinson. So patients are expecting that tremors will go away immediately. So any such condition, we have to always educate the patient that this is not a miracle treatment that you will get a result within one day. You have to come repeatedly for at least 7 days, and you have to do this process regularly and follow whatever do's and don't they are advised. Because we have seen while performing Shirodhara, specifically in the insomnia patient themselves get a proper sleep on the table on the 3rd day or 4th day of Shirodhara. They become very anxious that we are doing Shirodhara, and on the first day when they go back and come on the next day, they are asking us that we didn't get the proper sleep. So it is always beneficial for the doctor to explain them that don't expect a miracle in one day. because the treatment itself is so famous and result oriented that people have high hope and they are expecting a miracle effect. So that is why you have to always suggest that wait for minimum 7 days, but this is our practical experience that by 3rd or 4th day people themselves get a good and the proper sleep. Again, for the insomnia, we would like to advise, and also what was our observation, that if people are taking drugs for the insomnia, do not ever try to discontinue on the very first day. It is always advisable to discontinue this drug in the tapering dose, and that too also after 4 to 5 days of the Shirodhara, you can just decrease the 1/4 of the dose, and slowly with the next week you can decrease with the half, and like that with the tapering effect you can decrease. It may be observed that for the insomnia or chronic conditions like Parkinson's, hemiplegia, migraines, we have to be careful, and we can also go for the repeated sessions of the Shirodhara with taking proper gap in it. So this will help for the proper circulation of brain, blood brain, and in the mind also. So calming of the mind, getting the meditation effect, and in the proper gap will always help to get the best result in the Shirodhara. So it is actually a very sensitive mind body therapy that requires a careful attention to environment. We have come across that people are practicing Shirodhara as a weekend course, and also it is practiced at any time of the day. So this is also not advisable, because we have to perform it preferably in the morning hours. Evening hours also it is performed, but whatever desired result is there, we get the result more on the morning hours rather than the evening hours. So this is again very important, and the continuity of the treatment, because just now only I described that in insomnia we are getting result after 3 to 4 days. Now suppose we are doing with the weekend courses, so it is just like a 2 days. So in 2 days the result has just started to give its effect, and then we again discontinue and it goes at the next weekend. So the continuity is not maintained. So this is very important to understand. Because of the time constraint, because of the busy schedule, people are not able to pay the proper attention to its duration, to give the proper time for the treatment, and at the same time to follow the do's and the don't which we are advising them for the Shirodhara. Because if we are suppose eating pulses, lot of pulses, buttermilk, people are having the habit of taking lot of buttermilk and curd. So all this will also cause disturbance of Vata and Pitta in your body. So this disturbance should not be there, because when we are performing any Panchakarma treatment, there is little disturbance of Vayu. And at the same time, if you do not follow the do's and don't of the treatment, then both this vitiation, instead of giving you beneficial result, they are going to give you the negative effect, or you may not get the desired effect. So this is very important that stepwise whatever instructions we are given about the pre-procedure, about the main procedure, and also about the post procedure, it has to be followed properly to get the desired result. So the technique, patient behavior, post procedure care, these are all important, though they are very minute. They are very minute and people are not able to follow it, and they also take it this treatment as lightly. So it should be strictly followed to get the desired result, and it is widely practiced for the various psychological conditions, psychosomatic conditions. Again, we also have sometimes people have the queries like psoriasis or IBS. These are the conditions where you need more of the somatic treatment, or that is oral medications. So how come you are doing or treating the patient with the Shirodhara? So there also we have an answer that if it is related like psoriasis, psoriasis is completely a psychosomatic condition. So it is a condition where you need to calm down your mind, and it is completely stress based disease. So if we control the stress with the Shirodhara, then we can get good result even with the internal medicines, and parallel we can do Shirodhara. The same is also explained with the IBS, where it is irritating bowel syndrome. They are also taking the internal medicines, and along with that we can also give the Shirodhara. So this way there are some psychosomatic conditions where if the brain or the stress is involved, then we can correct the stress with the Shirodhara, and we can get good results taking both the treatment, Shirodhara and internal medicines. So a sequential and properly guided procedure of the Shirodhara will help to calm down the mind, and we get the better results in all these conditions what we described. And that is why in the present era, the hurry, worry and curry, everybody is having a hurry, nobody has time, and all are involved with whatever age, people are involved in stress. So that is why not only nationally but internationally Shirodhara has widely gained its popularity. Hope you may also practice this way and you get the better result and understand the procedure nicely. Thank you.